Fatima KHUDAIR was diagnosed with leukemia 11 months ago. She is 4 years old. Her father brings her to this government cancer hospital in Basra for chemotherapy treatment. But the drugs needed to keep her alive are often in short supply.
We don't know whether she will get better. I'm very afraid because I see many children who come to this hospital dying of cancer. The number of chemotherapy sessions she needs varies each month. But sometimes we have to delay coming because there is no bed available.
Around 70 children are being treated for cancer in Basra's Children's Hospital. Experts say pollution from surrounding oil fields is one of the reasons why Basra has the highest rate of cancer in Iraq. Iraq used to have some of the best hospitals and medical expertise in the Middle East, but decades of war, conflict and political instability means that those days are long gone. The situation at this cancer hospital is so bad that doctors here say they have to rely on cash donations to buy up to 75% of the chemotherapy medicine they need every month. Patients say health services are particularly bad in southern Iraq. Basra is the largest oil-producing region in the country, but there's little sign of petrodollar spending at hospitals like this one. People in Basra have long complained of neglect and what they say is corruption and financial mismanagement by the federal government in Baghdad. Protesters set fire to the provincial council building during demonstrations last year. At least 30 people were killed during the unrest against the lack of services. Doctors say they often can't provide the basic needs.
We're facing a crisis on so many levels. We can't provide chemotherapy treatment fast enough. It's not always available. It's expensive and getting it involves a lot of bureaucratic red tape. We also need more trained medical staff.
The regional government in Basra says federal government leaders in Baghdad must do more.
There hasn't been enough financial support from the federal government for many years. This year we were allocated 2.8% of the federal budget, and that's nowhere near enough. And we need a better share of Basra's oil sector revenues or things won't improve.
On a wall in the hospital is a mural called the Tree of Life, showing photos of children who were treated here and survived. The government in Baghdad, which in recent years has struggled to cope with the battle against ISIL, has promised to do more to help. Doctors say that if it doesn't, then many more cancer victims like Fatima will die. Charles Stratford, Al Jazeera, Basra.